Well, welcome everybody to the August Western Reserve Safety Council program, The Evolution of Safety and the Road to Post-Pandemic Prosperity, featuring our wonderful partners down at the Cuyahoga County Board of Health, Kevin and Suzanne. We're going to go ahead and get started with the program now. Please note if you have any questions throughout the course of the program, you can send a chat to Kaylin Mills or myself, and we'll be sure to get your question asked at the appropriate time or get any questions answered that you may have. In addition, the slides from today's program will also be found on our website at solonchamber.com/slides if it's easier for you to follow along in that format. So welcome everybody. All right, so just a couple Solon Chamber pieces that we have, and I'm sure this is true of every chamber and every organization in Northeast Ohio. Everybody's in need of workforce development, and we have found that collaborating together is far easier than trying to do it, on our own. So be sure to reach out to us if you have any questions, or our partners at and colleagues at the Aurora Chamber. Karen Bosley is on the program as well. Just let us know. We're going to solve this together, and then obviously, if you're like me and you've had your air conditioning running 24/7, we've got some incredible energy program savings, and then certainly as being a member of either of our chambers, you have the opportunity to have significant discounts on your healthcare benefits. So feel free to reach out to myself, Karen, anyone at either of the chambers to do that. And then from a professional development standpoint, we've got a wonderful LinkedIn group, idea sharing. Hey, this worked for me for hiring, or hey, do you have a thought on A, B, or C? The LinkedIn group for the Safety Council is a great option as well. So here's our agenda. I'm going to shut up soon, which is the most important thing on the agenda. It shows up on my screen, but not yours. We're just going to have a couple of updates from BWC. Just some updates on what the calendar year is going to look like, and then we're going to turn it over to Kevin and Suzanne. Make sure you get your questions answered. So, but first, I'm going to turn it over to Dan Quano from BWC to give our monthly BWC updates.
Hey, good afternoon, everybody. Thank you, Tom. And just wanted to give you a few things going on. Excuse me, they have extended the COVID indoor air quality assistance program. So if that's something that you would like to look into as a business, you certainly can, improve indoor air quality. It covers improvements to indoor heating, ventilation, so the HVAC system. And then there's the eligibility requirements. So if that's something that you're interested in, let me know, and I will see what I can do. Next slide, please. Grants program, those 4 grants are still up. Excuse me, I apologize, are still up and going. We have the trench safety grant, the firefighter grant, the employers working with persons with disabilities grant, and then the school safety grant is always is there as well. So those 4 grants are available to everyone. Some important dates for private employers. Just want to remind everybody, we had a meeting about this recently. Just make sure that for private employers, that your true up deadline, that you have completed your true up. So just remember that, August 15th. And then we have this DFSP, the Safety Action Plan, is due for private employers there towards the end. Now we're getting into September. This year is going quick. So remember September 15th, your individual retro statements for the policy year, and then private employer snapshots for September 30th. So think about those for those in the private industry. Public employer dates, September 30th, there's a number there as well. There's 4 of them there. The progress reports for DFSP, EMCAP. So if you need to, put these dates in your calendar so that you remember these, and so that you're not late on some of your reports. Next slide, please. So our monthly webinar, we get all of our information from these BWC employee webinars. So in the August webinar, they talk about the true up report reminder. The next one is August 26th at 11:30. So if you need to refresh some of those dates or get some more information, you can certainly reference the employer webinar there. We have a number of, we're still continuing with the safety webinars as of now. So if one of these webinars, looks interesting to you, you can certainly attend it. 7 Habits for Highly Effective Safety Teams. There's a couple of members on, well, one person from my team and then a technical advisor that's going to be teaching that. So that's a good program or safety webinar if you're looking to start up a safety team at your particular facility. Next slide. All right, super. The DSH virtual training, these are going to be continuing on for the rest of the year. So we have a number of them listed there. If you need more information about some of these trainings that come up, let me know, and I can certainly forward you the schedule that we have. It's basically the one that you see there on the screen, but if you'd like something personally, I can certainly do that for you as well. And we get updates, as months progress of these virtual trainings that come up. So if that's something that you're interested in, or you want to be on like a mailing reminder about some of these, let me know, because I can certainly send these out to you so that you can view them. Our consultative services they're currently suspended, but we're still providing services, via phone call, email. I still meet with employers over the phone or through MS Teams. We do all of our training through WebEx. And as the future progresses with the BWC, even whatever quote unquote normal becomes later in the future, we still will be doing a lot of virtuals just to save on time and more efficiency. And that will still be continuing. But when we get to go back out in the field again, those are going to kind of be sporadic. So we're kind of looking at a different approach of how we do things, but still providing the same services to you as always. So, and then of course our COVID resources. You can go to ODH or the BWC if you need any information regarding COVID. So that's all I have. I appreciate your time, everybody, and I hope everyone's doing well and staying safe. And I'll turn it back over to Tom. Thanks, Tom.
Yep, thanks, Dan. Some important updates there. And if you ever have any questions BWC related, you can reach out to Dan. Great resource. You can also administer a quiz on all the acronyms and see how many you get correct, because I think I get them all figured out. And then once a month, Dan gives me some more things I need to learn about. So we want to show you a quick 2-minute video or so about what fiscal year 22 is going to look like. It is going to be virtual, but different ways to get involved, perhaps on how to share that within your company, across employees, or with folks in other industries. So this is just a quick video. I've been assured that the sound works. So here we go.
Coming to you live from Solon, Ohio, we are proud to sponsor, in collaboration with the Ohio Bureau of Workers' Compensation, the Western Reserve Safety Council, your go-to spot for content related to safety. We are excited to deliver this program to you virtually this year. Sponsorship opportunities are abound. Content is free. We look forward to serving you and your safety needs as we convene and connect around the evolution of safety through COVID and beyond.
As you think about the content that the Western Reserve Safety Council shares out on a monthly basis, have you ever considered sharing that more broadly within the site that you work at? Or maybe it's in a sister location here in the state of Ohio, or maybe you have multiple sites throughout the United States. As I was looking at content over the last year, I would forward the invitation, the Zoom invite out for topics such as ergonomics or returning from COVID. And I had colleagues throughout the nation be able to kind of jump on our Zoom call and be able to see, hey, what are we doing here in Northeast Ohio to try to help out? Perhaps it's bringing together your safety committee for a lunch and learn as you watch the content for the month, and then maybe talk about, hey, how can we implement maybe one strategy coming out of that? Consider ways that you can share it more broadly than just yourself, because once you have access to the content, you can share that throughout your company. And we encourage you to forward that invite along to help the most people get the content that'll help us all work safe.
WRSC really offers a nice opportunity to get together with some of the largest companies in Northeast Ohio to share ideas from a safety perspective as well as a general leadership perspective across companies of a broad spectrum. Some of the smaller companies that might be individually owned or a small leadership group, or some of the larger companies that have several locations throughout the Northeast Ohio as well as throughout the world. There's a nice opportunity to share best practices, experiences, and see if you can apply lessons learned to whatever your facility is needing at the time.
I think each of us are evaluating opportunities and how we can make a difference. We were very proud and happy to be a partner and sponsor with the Western Reserve Safety Council, and it meant three really important things to us. The first was an ability to have visibility. On a monthly basis, all of the sponsors, the regular sponsors, are featured prior to the meeting. Secondarily, it was our opportunity to make a meaningful connection with the members and guests who attended the monthly meetings. The third, it was our opportunity to engage in education, not only to share the resources that we had available, but also for us to learn from the featured speakers. So if you're looking at sponsorship at the Western Reserve Safety Council, I would say do it. It's absolutely fantastic. And most important, it gives us all an opportunity to engage in a much larger and meaningful conversation to help make workers safe at their companies, at your companies, not only at work, but at home. And that's what it's all about. Have a great one.
All right, I only had to pause the video once. Usually I'm about 10 times on that. Before I turn the meeting over to Kevin and Suzanne, there is some sponsorship information and opportunities there if you want to, feature yourself at an individual meeting several times during the year. As we indicated before, we're making this content free for all, and then we're looking at covering some of our internal costs via some of these sponsorship opportunities. Give us a call, shoot us an email if that's something that interests you. So we've got 3 sponsors lined up so far: Zerkoa, SwageLock, and Greater Cleveland Habitat for Humanity. So we welcome that along with our founding sponsors who are listed on this slide as well. Here we go. So we've got Zerkoa making things that I didn't know existed, but they're in everyday life. So different products. In your upper right, you see that artificial hip joint. I got one of those. So thanks, Zerkoa, for getting rid of that arthritis. Nothing further from me. I'm going to turn it over to Kevin and Suzanne, who are going to guide us through an update as, what have we learned from a safety perspective over the past 18 months and where do we go from here? So take it away, Kevin and Suzanne, and thank you for your willingness to partner with us again.
Absolutely. And thank you, Tom. We appreciate it. Thank you all for being here. We appreciate the invitation to come back again. And we also like to acknowledge Mayor Kraus. We appreciate his presence being here. I'm sure he'll glean some valuable information here. And I want to also send a special thank you to Kaylin for being so efficient and helpful in helping us to pull all this together. So I am Kevin Brennan. I'm the communications officer for the Cuyahoga County Board of Health. And this is my esteemed colleague, Suzanne Rush, who is the program manager for our food protection unit and until recently was also the program manager for our school environments program. So Suzanne has lived the entire pandemic through the lens of school districts. So she has a very unique perspective. She's also a partner of mine on our internal communications team. So we really appreciate her being here as well. Next slide, please. Thank you. All right, so what we're going to talk about are some of the lessons that we've learned from the pandemic through our eyes here at the health department, and how those really relate to safety. You know, whether it's business safety, personal safety, kind of general safety, we want to make sure that we're providing you with the most updated information that we can from a Board of Health perspective. So we're going to start with what we know to be true. Science has proven over time that vaccines work. You can see this list of illnesses here. And, you know, these are illnesses that have either been eradicated or severely or seriously minimized by the presence of vaccine. The one thing we look at there is influenza. And the reason I want to mention that particularly is because influenza is somewhat like COVID, in that if it is not controlled, it will continue to mutate and become more virulent. And we'll talk about that a little later. But we want you to understand that from a public health perspective, one of the best tools that we have are vaccinations. They help us prevent illness. They help us reduce the severity of illness among people who are unfortunate enough to become ill. They keep us on our feet every day. So it's as I say, it's one of the best prevention methods that we have in a public health toolbox. And we know now that thankfully, thanks to the work of people much smarter than I and much more accomplished than I am, that we now have vaccines. And the fact that we have the COVID vaccine is a blessing. And I'll tell you, the COVID pandemic started for us in January of 2020, when we first got word of what was happening. And it took until January of 2021 for vaccines to be even available on a public basis. So for us in public health, it was agonizing to watch people suffer. For those of you who have been paying attention to it, you know that in long-term care environments, the illness and death that we had to stand by and really just kind of not tolerate, but we had to witness over a period of several months was agonizing. It tore families apart. It just frustrated us to no end as public health workers, but we're so thankful now that we have the vaccine. So we really want to impress upon everyone to remember that COVID is now a vaccine preventable disease. So certainly it is our best tool in fighting further infection. Next slide, please.
But throughout the work that we've done on the pandemic, as well as public health work in general, there's always been sort of a layered approach or layered strategy to prevention. And some of you may have heard the analogy Swiss cheese, right? There's holes that penetrate where the pathogen can get through, but by different layers of prevention, things like hand hygiene and disinfection, things like mask wearing and social distancing, disinfecting of high-touch surfaces, and especially monitoring health symptoms of employees and having them stay home if they're not feeling well. Pre-vaccination availability, it was super important that these non-pharmaceutical interventions took place. But what we found is it's just as important now that they take place. And we are recommending in our own office, and we should give you the disclaimer as to why we're not wearing masks. Kevin and I sort of consider ourselves in the bubble. We pretty much eat lunch together and do work together every single day. So we will sit close near each other, both being vaccinated without social distancing and with our own immediate families. But with other strangers or when we're out in public, we are always masked, social distancing and hand hygiene. So it's a matter of keeping just a few people that are close knit to you without masks. And then for other folks, when you're out with strangers in big crowds, you know, when you don't have the option to social distance or don't have the option to have hand hygiene, at least wearing the mask and trying to do the best you can is paramount.
Next slide, please. Okay, so a common question that we get at the Board of Health, and we've heard it asked on television, we've heard people talk about it endlessly, debating the issue. Why does the guidance change? Why do CDC and ODH and even you at the Board of Health, why do you change your guidance? And there's a very simple answer. Because viruses mutate as they spread. As I alluded to before, the reason that we don't have a standard flu vaccine is because flu mutates every year, and we need to make sure that we're staying on top of it in terms of what strains are predominant, what strains are really more likely to affect us. And so each year there's a design team that puts together what they believe is the best collection of vaccine material to make sure that they're effectively fighting those strains. So what we're seeing with COVID is the strains have become more virulent or more aggressive. We know we had the original Alpha strain. Worldwide, we've also seen a Beta strain, a Delta strain, and a Gamma strain. So right now, the predominant strain here in Ohio and nationwide is the Delta variant, which we'll talk about in a minute. But the way that viruses continue to mutate is because people are not getting vaccinated in large enough numbers. Now, we know certainly that there are people for medical reasons who are unable to get the vaccination, particularly those with autoimmune diseases. And it's not only the COVID vaccination that could cause them issues. Sometimes it's any type of vaccination or any introduction of something new to the body that's not typical for them can cause a lot of triggers with their illness. So it is incumbent upon us even further as individuals who are able to receive the vaccine that we do so out of a sort of a civic-minded approach, right? We need to protect those who are unable to protect themselves. So for public health officials like Suzanne and I, this is extremely frustrating when we see people who are able to get the vaccine from a medical or physical standpoint and they refuse to do so. So that refusal or that standpoint or that choice, whatever we choose to call it, that is what allows the virus to mutate. So that's why we now have 4 strains worldwide, and it could be that we have even more. And some of these strains on their own are becoming more aggressive, as we noted. So herd immunity cannot be achieved until enough of us get vaccinated. Now, I'm neither a doctor or a nurse, but I know from what we see from CDC, the target is about 85%. That's what we're looking at in terms of really considering it herd immunity. So given that we are only slightly above 50%, I think statewide and locally here in the county, we certainly have a long way to go. Next slide, please.
When we talk about this Delta variant, there's something important that we should all recognize, and that is it's spreading very, very quickly because it's twice as contagious as the previous strains that we had seen, and 1,000 times more virus is shed by coughing or sneezing. It's now the dominant strain in the state, and we're seeing small children passing this much more easily and readily than we did with other strains, like the one from Great Britain. So it's important that we recognize that although you can still get COVID-19 if you are vaccinated, you're much less likely to have severe symptoms, including hospitalization, the need for a ventilator, and or death. So the idea is the more people vaccinated sooner, the better off we all are. Next slide, please.
So now we'll get into a little bit of what you can do as business owners and people in the community to help make sure that we're doing all we can to minimize spread. One of the things that we talk about regularly, practically every day in our food program, is the need to exclude and restrict people who are ill from a food environment. The same thing goes in a work environment in terms of COVID, right? So we've offered this document to you. I'm sure this slides will be shared and you'll be able to click on the link that's contained here in the slides to access this document. But it does a fantastic job of explaining to you why it's important to report illness, why it's important to restrict people, and why it's important to exclude people. So now I'd like to turn it over to Suzanne to just color this in because she's got far more experience than I do with this.
Before we go ahead on the slide, I'll just mention the difference between excluding and restricting, because sometimes those are used interchangeably and they are different. When it comes to assisted daily living, which would include things like personal hygiene or personal care of someone, feeding someone, or actual health and remediation, where you might do a treatment on someone or help them in a healthcare setting, or in a food service operation. Those terms are used both exclusion and restriction. Excluding being you have symptoms that are so communicable that it is too dangerous for you to work doing direct patient care or feeding people or washing dishes, so you have to leave the facility. Restricting, on the other hand, usually allows you to remain in the facility because it's not that communicable, but to stop to restrict those duties. So you don't do food or personal care. So maybe if I worked in a restaurant and I was on restrictions because my only symptoms were sore throat with fever, I may be asked to, paint a sign for outside or cut the grass or sweep the floor or call in a food order. But I wouldn't be handling food or dishes, and I wouldn't be doing any serving of folks. That's the difference between excluding and restricting. Next slide, please. So our operators regularly ask us in food and long-term care and hospital settings to give them a simple, down and dirty, easy solution to handling how we handle customers, or I'm sorry, employees who call in sick to us. And one of the first things that we need to do is identify a person in charge who's responsible and has been trained in the protection of employees. And in your settings that are not food or healthcare related, you would have probably an HR person who would handle those calls, or a manager who handles those calls. So one of the things that you want to ask the person, and again, this chart here is geared more toward food, but you could make it any kind of communicable symptom for any kind of business. But a good important thing to ask would be, do you know if any of the symptoms you have are communicable? And maybe give the employees ahead of time a list of those symptoms, things like diarrhea, vomiting, sore throat with fever, jaundice where their skin or eyes look yellow, or open lesions or wounds on their skin. Those would all be reasons why someone probably should be seen by a healthcare worker, unless there was a logical explanation. Let me give you an example. I'm a young lady and I just became pregnant and I'm nauseous because of my pregnancy, and my OBGYN has already told me you're going to probably have this nausea for a while. The good news is it's nothing communicable. You just are morning sickness. We can't catch pregnancy, right? But still, I can't be vomiting in the food service because normoflora or background bacteria that might be in my vomitus or on my skin could contribute to illness for other folks. So I still would stay home and rest until I got over the vomiting. But what you see in this decision tree here is, if you ask the person, do you have something that's communicable through food? If they say yes, it tells you exactly what you should do. If they say no, or I don't know, you review the symptoms to make sure they understand what's expected of them. And our default, because we do buildings at our place, we say to folks, listen, the nurses on the nursing side, they handle the people. We handle the building. So if somebody calls me at one of my schools or one of my long-term care and says, Suzanne, should I exclude or restrict this employee? All I'm really qualified to do is ask about those symptoms. Let's say the employee says, I don't care to discuss it with you. You certainly could have them call the Board of Health. It may be something personal or private that they're just not comfortable sharing. And you know, we always say that it's unfortunate in America, we have this stigma around certain diseases. If you tell someone you have a cancer diagnosis, people are giving you fruit baskets and flowers. If you tell someone that you have a sexually transmitted disease, especially HIV, you can be literally discriminated against. That's why there's laws and rules against it. So we want to keep all this HIPAA protected information private, and we'll give you, as we go through, some tricks on how to do that. But in general, a qualified person should handle the symptoms rather than the name of the disease. And if need be, that a person should be having a medical professional give them a note to clear them to come back to work when they're done being sick.
Next slide, please. Now we want to touch on something that I'm sure is familiar to all of you, but we want to talk about how it applies from our experience related to the pandemic. So absenteeism, right? People not being able to come to work due to illness. Presenteeism is people coming to work who are ill and probably should not be at work because they're not able to perform their job to the duties or to the level of expectation that's been set forth. They could be distracted from their duties. They could be wasting time. They could become inefficient. They could become a safety hazard. So these are the things that we want to make sure that we're drawing a distinction between these two things. But we also like to dive into this a little deeper to let you know some of the things that we found by doing a little bit of research as a result of what has occurred during the pandemic. Next slide, please. All right, so when we look at this, we look at rates and we look at costs. And I think what we want to go to is that yellow tab that is highlighted. When we look at the cost and we look at in the United States, this is a comparison, as you see, between the United States and the United Kingdom. $150 billion is the cost of presenteeism this year. So, you know, when you walk around your facility as the owner or the manager or the supervisor, and you see people not doing their job according to what you think their job should be, there could be a variety of reasons for that, right? But one of the things that we know to be true is from COVID, due to sometimes people being symptomatic, but not being symptomatic enough to feel that they need medical care, they'll still come to work. People will be distracted by the anxiety that COVID can cause. People will be distracted by issues with other family members, right? So there are a lot of different reasons for people, you know, not performing up to that level of expectation, as I mentioned, due to presenteeism. The other piece is the cost of absenteeism per employee. That's quite a substantial amount of money. So you're looking at, you know, what you're paying somebody per hour, per month, per year, and then you have to almost off the top subtract that total that you see at the bottom there because that's just a given based on research that's been done, obviously internationally as well as nationally. So you're almost at a disadvantage because we've made it such in our society that the expectation is that people come to work almost at any cost. And I think Suzanne's certainly seen that in the food industry. I'm certain, seen it in manufacturing and other venues. And so, it can be a very difficult situation.
Just to give you an example, one of the largest outbreaks I ever investigated, a foodborne illness outbreak, was at a hotel in our jurisdiction here in Cuyahoga County. They had 4 parties with about 1,600 people at this hotel over a 3-day time frame. It was in January, mid-January or so. It was latent holiday parties that businesses were having at their facility. And about between 500 and 600 of those persons became ill with gastrointestinal symptoms, upper and lower GI distress. And we spotted right away that it looked like norovirus was the culprit, and it in fact was. And what it all came down to, when things were said and done, Barry Grisey, one of our young SANs at the time who was being trained, calls me. He's just totally distraught. And I said, "What's the matter?" And he said, "The chef just doesn't get it, Suzanne. You need to come here. You need to come here now." And so I head out to help him. I'm one of the epi trainers, and I help people with epidemiology to study disease. And I get there, and the chef's like, "How dare you? How dare you even question me? I was here through thick and thin. I was here this entire week. I did not miss 1 hour. I was sick as a dog myself. Lower GI distress, upper GI. I threw up on the line, for goodness sakes. I was so sick. How dare you question my integrity?" And he just didn't see the impact of working sick. And so we don't want people to learn the hard way how a business can become devastated with something like a nora outbreak. And one person nearly died from that. Thankfully, she did not, but she was so ill and dehydrated as a senior. So just keeping in mind what Kevin is saying about your presenteeism being a dangerous safety risk for your business, we just wanted to share that with you. Next slide, please. So we talk about the causes, right? The disengagement, the burnout, the high levels of stress. We're seeing this in our own industry. Everybody's talking about, emergency medical services and hospital capacities. I don't hear a lot of talk about public health, but I can tell you from personal experience, we're all fried. I'm sure in your industry, you're fried as well. The wild card is a safe work environment due to pandemic conditions. We want to make sure that we have safety. We want to make sure that we have the numbers of people, or we suspend operations or we alter operations. And we've said that to a number of our food facilities. We said that to a number of our schools who say, we can't offer French lecture right now for the preschool kids. We can't offer ballet. We can't offer, we're suspending. We don't have enough people. We have to do the basic functions that we have to do and sort of continue our continuity of operations based on need and based on resources, what we have to offer. So yeah, go ahead, Kevin.
So the one thing I want to mention is, if you recall one of the first slides we showed you with the picture where Suzanne mentioned the non-pharmaceutical interventions, we highlighted telehealth as being one of those things. And we found it to be extremely advantageous to companies who are providing access or direct care to their employees in terms of mental health services. Because what Suzanne's referring to, and what we've referred to, this anxiety, this stress, this worry, it creates safety hazards for you, it creates inefficiencies, but it also doesn't do anything to relieve itself day to day to day. And you're having people come in with the same issues over and over again. So if you can work with a provider in your community, if you have somebody on site that's qualified, or if you can provide online access to, or for your employees to partners that offer these services, we would highly recommend it, because we've seen this happen in some of the industries, particularly as Suzanne mentioned, in the healthcare industry and in public health both. We have access to online mental health counselors, and they've done a tremendous job in helping some of our people relieve their stress. And sometimes you just need somebody outside of your organization to tell you, you have 1,000 hours of sick time. You have 300 hours of vacation time. Take a little bit of it. Your employer would rather have you take off for a prescribed period of time, come back and be refreshed, and then bring the value that you typically bring to this organization. So please make sure that you're appreciating the value of mental health services.
We talk a lot about worker guilt and what people feel like when they're at a place and they're short-staffed already and they're working with a lean crew and they already feel the burden of COVID. They feel extra guilty if in fact they take time off or take time for themselves. So empowering your employees to do so can be really important. We used to goof around in public health about what we called Cedar Point sickness, right? Your employee just got tickets as a surprise from someone to Cedar Point and they're not coming to work. We don't see that anymore. What we see more often than not is people working sick for people working when mentally they're not prepared to go to work because they don't get paid sick leave or they are out of PTO. So we want to be careful with that. Next slide, please. So stress, we talked about 25% of workers, and we did give you resources for where we got this information, but about 25% say that stress is costing them at least an hour of work each day. So if you have positive ways, if you want to talk return on investment, positive ways to mitigate that stress or find mindfulness exercises that your team can do maybe on a walk or on a lunch break before work or after work, that increases efficiency and it's well worth the money or investment in you.
I think what's an important thing to look at is that last bullet. Here in America, we're more likely than residents of other countries to experience these conditions. If any of you have international partners or international connectivity through your business, you might want to engage the people who are in charge of human resources and healthcare options to see what they're offering. I mean, certainly some things are cultural and inherent to our society, but it would be a good idea too to look at what other countries or what other cultures are doing to try to relieve that guilt from people taking days off and to make it more reasonable for them to feel like they need to care for themselves. Next slide, please.
All right, so we talk about stressed workers being unsafe, and if you lost focus, that's when worker incidents happen. I had the pleasure for a couple of years of working at a large manufacturing company in Cuyahoga County, and we regularly had wellness and stress checks performed by our HR, and it really made me feel like I was a valuable member of the team. It was a reason that I stayed. It was a very hard job, very difficult. I was a welder, and it was hot and heavy and dirty, but the people there cared about me, and that mattered. Safety professionals should take the issue seriously and let workers know that help is available if they need help. And I think identifying these problems in advance, we've all seen the terrible things that happen when people are overburdened or overstressed. We've seen the people come to work with a gun or have terrible accidents at work that harm or kill others or start fires or just injuries and bad things that can happen. So worker safety should be the primary focus. It's the one resource that's absolutely invaluable to you. You need it more than anything else.
And we know that, you know, it's been difficult for a lot of companies and a lot of just organizations in general. The pandemic has caused financial burdens for companies, right? And we certainly appreciate that. But you don't want to place that above the value that your individual employees bring for you. And we don't mean to insinuate that any of you are. We just see that, you know, as sort of an unfortunate side effect here in America, where sometimes we chase the dollar more than we value our employees. Next slide, please. Okay, so here are some remedies or some options that are available to you to help you understand how to cope with absenteeism and presenteeism. I think what we've really honed in on is that number 2, the bar, be flexible with your paid time off and implement a clear policy in terms of trying to keep yourself healthy as well as accommodating people with days off for illness. Because as we've said many times now, COVID has created a situation that I think is unique to all of us. We may be able to relate it to things that we've seen. Certainly, you know, we've talked about things that are kind of cousins to this in terms of communicable disease. But in terms of COVID, it is a highly unique illness and it has caused some incredible, you know, as we say, financial and emotional and mental burdens to people. So we just want to be clear that people feel comfortable in taking care of themselves. And I think encouraging health and wellness on that third bar and improving the culture, not to say that any of you necessarily need to improve your culture. I think it's more that you need to be mindful of the effects that COVID can have at eroding employees' ability to deal effectively with that work-life balance. Next slide, please.
So one of the things that we like to do, Kevin and I, doing communications and marketing for the Board of Health, is to constantly update what kinds of signage that we're providing for folks, options for stickers, whether it's hand hygiene, covering the cough, choking posters, anything that reminds people about health and wellness and safety in their facility. And I can tell you anecdotally, I've not done a formal study, but I've had at least in my 29 years, at least 5 operators contact me and say the choking poster that was hanging in their lunchroom or near their vending machine saved someone's life. That someone knew how to effectively do a Heimlich maneuver because of the poster and they wanted to thank us for it. So having signage out and frequently changing it to get employee buy-in and make employees pay attention is important. Next slide, please. And well, this is another example of slowing the spread of germs. There are on CDC and ODH's website, as well as our website, a variety of posters about non-pharmaceutical interventions. We welcome your input. If there's something that you need us to help you design or give you ideas for, we would be happy to maybe customize. So if Swagelok or Nestle or Ying or one of these companies wanted their own signs, we'd be happy to. Anytime you're pushing forth health and safety, we're all for it. We'd be happy to work with you and give you ideas.
Next slide, please. So one of our valued partners who has been with us in my entire career in public health, and I'm certain for decades, preceding my employment with the Board of Health, is United Way and their offer with 211. So from a landline, you can call 211 and you can get a wide range of access to social services. So whether that's mental health services, whether that's help with childcare, whether that's help with possibly finding medical care for yourself or your family, there's a whole list of things that are available. One of the things that they did that was very valuable for us during the pandemic is if people did not have internet access, through the generosity of the Cuyahoga County Executive's Office, they engaged operators from 211 to talk to people over the phone to help register them for vaccines. We all remember in 2020 how frustrating it was, and going into 2021, how frustrating it was for some people who could not quickly access vaccinations. And so 211 was a tremendous help with that. I would encourage you as well, if you're able to click on the link here to watch. It's about a 5-minute video about 211, but it gives you a very clear idea of the value that they provide to us as a community. Next slide, please.
So some of the things we do at the Board of Health, and we always want to encourage, if you would come up with a medical situation that you either don't feel qualified to answer or you want more information, please to contact our clinic. You do have access to low-cost services such as adult and child vaccines, back to school, for example, COVID and other flu shots, other vaccinations, testing for HIV, lead, and tuberculosis, all sorts of wide range of sexual health services. And we have a travel clinic if you'll be traveling internationally. In general, if it's a health or safety question that's regarding someone that works for you and they either don't have someone medical to ask, or you just want significantly more information, be it about a medication or symptoms, we want you to contact us. Again, Kevin and I, that's not our field of expertise, but our nurses and the physicians that we partner with, including our medical director, Dr. Heidi Gullett, who you've probably seen on TV, they're more than qualified to help you in those circumstances.
Next slide, please. So this concludes the presentation portion, and we would certainly welcome any questions that you may have. We will try to do our best to answer them. If we don't have an answer, we'll be glad to find one and then forward that back to Tom and Kaylin for distribution to the group.
And before we forget to tell you, that line there, the 216-201-2000, that phone has a person from our agency answered 24/7. If you call that number, you'll receive paging instructions, although after 4:30 on a weekday or on the weekend, we would ask that you only utilize that number in an actual emergency because it's for a public health crisis. An example would be this overnight yesterday, someone was grazed by a bat. It tore the skin and that bat did test positive. The results came back after hours. The person was actually grazed, over the weekend. So that would be something we had to act on to prophylax that person to save their life. So something like that, absolutely public health emergency.
Thanks, Kevin, and thanks, Suzanne. It's always great to get your perspective on what, from a public health perspective, on what's out there. Audience participants, we're going to launch a series of 3 questions from a poll perspective that may help facilitate some questions yet. I do have a couple questions in the queue to ask. So on your screen in just a moment, you're going to see question, answer it, and then we'll move to the second one, and the third one should take about 2 minutes, 3 minutes total, and then we'll get into Q&A. So here we go. I'll give about 20 seconds or 30, about 20 seconds left on this one. All right, so I'll just flash the results on that real quick. It's about just under 80% yes on sharing if your company asked you, and just over 20% no. Which is going to lead right into, now we're going to flip hats. And if you're a business owner, or if you're not a business owner or not, in HR, what are your thoughts on, do you plan to mandate vaccines for your employees? We asked this question about 9 months ago, and the answer was everybody was no. And now, we're hearing, in certain sectors that is changing. And all of this is anonymous. We have no idea who is answering in what way. So we'll go ahead and end this one now. So, just under 15% yes, just over 40% no, 40% unknown. And so that's just, super interesting from our standpoint on how that landscape is either shifting, et cetera. So last question is coming up right now. As, do you feel you're able to provide sufficient and appropriate healthcare information for your staff? All right, so I'll share these results. So we've got 65% yes, 22% somewhat, and 13% unsure. So this is super helpful, from our perspective, and for the Board of Health to get just an overview of a sample size of where people are. So, from my perspective, the first question we would like to ask Suzanne and Kevin, if vaccinated people can still spread COVID, will vaccinations really ever stop the virus? Or is it like the flu, which is here all the time?
Well, there's two schools of thought there. Certainly, we believe it will be here. COVID will be here, just as SARS was prior. You remember in Asia, the first SARS that came is still floating around. We just think that the veracity of it, the ability for it to mutate, if we can knock down and put some space in between it. Right now it's spreading so rampantly because we still have so many people unvaccinated. So there's still large numbers and it's able to mutate quickly. We still feel vaccination is by far the better option, because even folks who get it when they're vaccinated have much minor symptoms. It's not that we won't have some breakthrough, it's significantly smaller amounts. If by breakthrough, we're talking about persons who are so severely ill with COVID. It's not just minor symptoms. They're so severely ill that they're hospitalized or die or put on a vent. So that's what we consider breakthrough. So we still feel vaccine is the way to go. Go ahead, you want to jump in?
Yeah, well, and I was just going to say a little bit of that, Tom, is unknown, because as Suzanne mentioned, if these viruses continue to mutate, like with the Delta variant, right? We are now seeing children become ill with COVID symptoms in far greater numbers than we did at the beginning when it was just that alpha strain. So it is a little bit of the unknown. So the quicker that we can get, reach that point of herd immunity, as I mentioned before, the better off we are in minimizing any potential outgrowths or unknowns that could arise from continued variants among the virus.
Doctors who do epi for us have told us that it will probably take 4 or 5 years to us have a realistic picture. CDC and Global Health have realistic pictures of exactly how to treat these diseases, because it's still so new to everyone.
Thank you for that. I think this is probably less of a question, but maybe you can share your thoughts on that. I think what in our circles we hear so much of how, and you addressed it somewhat, is on guidance changing. You've got hesitancy, you've got all these different reasons out there as to where we're not. What as a as a participant on this call, or, as a, chamber, if I had one thing we had to share with folks, what is it? I mean, we know it's I don't tend to lead anything like go get vaccinated, because, unless I'm in my car and I'm ready to speed away really quickly, because I don't want to necessarily, hammer that subject, or is it my role? But what, just sort of one takeaway that says, what should I be telling, as a business owner, or what's one thing I should be doing?
Well, the one thing that we've seen, Tom, is, we've operated a call center during the entire length of the pandemic. And one of the things that we find is people call us and say they don't believe in it. Well, you know what? It's not about believing in it. It's not Santa Claus. It's not the Easter Bunny. COVID is here just as sure as the sun comes up every day and goes down every day, right? So I think the thing that, and we don't say this just because we're in public health. I think we believe it. We appreciate it more because we are in public health. But we need to defer to people who are experts. And I think what we've seen in unfortunately in our country is we're seeing a lack of deference to people who are experts. And I think unfortunately this virus has become so politicized for a lot of different reasons that it's diminished, people's ability to sort out the information. So what we would say is, the thing that we feel to be true is that we know in terms of communicable disease, whether just like the thing I showed at the beginning, right? We see mumps outbreaks, right? Sometimes among or polio outbreaks among groups who are not vaccinated. They travel overseas, where vaccination rates maybe are not high. They come back with the illness and they spread it. So, we know that vaccines work. So I think if there was one takeaway, I would say that we know vaccines work and they don't completely eradicate the illness. But when we look at COVID, this is a phenomenal efficacy rate for this vaccine. To be in the 90 percentile is far beyond, I think, a lot of existing vaccines. So when we look at the potential, you have a 95% chance in some cases of not contracting illness that's serious enough to make you hospitalized. I mean, that's an incredible statistic. So we really appreciate that. And then I think, unfortunately, the flip side of that is, we hear stories all throughout the nation, especially in states where they have low vaccination rates, of people becoming intubated on a ventilator who are pleading with a doctor or a nurse to please give me the vaccine. And by that point, it's too late, right? So I think the takeaway is, believe in the science and believe that vaccines work. And then we have examples, because a lot of the people who don't want to take the COVID vaccine, they've received vaccines for other illnesses in their lives, and they've been able to prevent other serious and life-threatening illnesses because of the vaccines that they may have gotten when they were children or young adults, or even, we see people, workplaces require particular immunizations for particular illnesses as well.
So if I could jump in, Tom, with mine, I would say even for folks who absolutely positively refuse, and I know some people are going to, for whatever reason, religious reason, political reason, whatever reason, they don't like to look at me, whatever reason that they decide not to get the vaccine, because believe me, I'm out there pounding pavement trying to get them to, but let's just say they don't. At least believe that the 5 non-pharmaceutical interventions that we talked about of mask wearing, hand hygiene, disinfection of high-touch surfaces, social distancing, and health screening. At least believe in those, because the other communicable diseases that we usually see in high numbers, including influenza, it's nothing for us. It's so sad, but it's nothing for us in a year to have 30 to 35 deaths in 1 year just in our jurisdiction. And we had 1 last year, 1, because of those NPI. So it's non-pharmaceutical. So even if you can't get behind COVID for whatever reason that you can't, those other communicable diseases we've been studying for hundreds of years as public health, we can say that those diseases were knocked down. Normally we would have 5 or 6 large foodborne illness outbreaks and 2 or 3 small. We had none. In 2020, we had 0. So those NPIs work all the time against other diseases as well. So people can believe in those.
Well, this leads into some of our fear and frustration with some, situations with school districts, right? That we see in Ohio and we see it across the nation, where the recommendation for kids to wear masks is not being enforced. And so, it could cause some very difficult situations, especially like I referenced before, with this Delta variant being so aggressive, and still we don't understand 100% about what all the implications of it may be. We feel like it's sort of a petri dish waiting to happen in schools. And we don't have relevant data because schools were closed, right? And so many schools went remote. So this is an evolving situation. So it's very difficult for us to really have a good handle on that yet. I'm sorry, that's a very long-winded answer, but I hope we provided some insight for you.
No, and that's super helpful. And now the questions are flying. So here we go.
Okay.
All right. So how are samples tested for the different variants, and are all test samples tested for variant type?
Mhm.
Unfortunately, they can't be for a bunch of reasons, not the least of which is expense. It's very expensive and time consuming. It takes a significant amount of material. We don't always have sample sizes that are large enough to do multi-testing. And to be honest with you, that's more of a medical professional. So I'm not even going to go on the how exactly. I know it's done genetically, but more than that, I'm sorry, I can't. I can give you my B+ science pre-med undergrad answer. I can't give you a medical doctor answer, but I'm sure that I can get something in writing from Dr. Bullitt, our medical advisor, and get that back to you guys on exactly how they're tested and who is testing them.
And to be clear, we do not do that at the Board of Health. We know that UH and the Cleveland Clinic are the two primary facilities here in town that are doing variant testing. I would say probably due to capacity, the clinic is probably doing the greatest amount of that. But again, with us not being clinicians, we don't really have a more insightful answer than that. But we do know that not all samples are tested for the variant.
Okay. And then here's a good one. This could be one of my favorites. So if a customer asks about an employee's vaccination status, what can we say or not say?
So with any medication, any health condition, any symptomology, less is more. Less is more. This is what I would say. I would say something along the line of our agency or our business has made a concerted effort to encourage vaccination of all of our team, because we feel that vaccination is the quickest way to herd immunity to prevent the spread of COVID and the development of variants. I would leave it at that. I would always do a 10,000 foot view, because where does it stop, right? Okay, well, I also want to know if that person's pregnant. And I also want to know if that person has a physical handicap. And it's crazy. The thing should be, that's really not the customer's business. The customer's business is with whatever you're selling or making for them or whatever service you're providing. It's really not about your employee's health. That being said, if you have an employee that's at the cash register doing the coughing like a fiend, I don't blame the customer if they're questioning, is this person vaccinated? Are they exposing me to something? So having policies that encourage, if you have communicable type symptoms, you're not being in work, that helps. And showing that to the customer. I would say your health and wellness policy would be a better thing to show them than individual health records.
And I think your recommendations, how you decide whether your employees are going to wear masks or not, right? Obviously, as I think you would all know, we recommend in indoor settings that everybody wear masks regardless of vaccination status. So if you have that posted upon your doors and your entryways, and you have it maybe on your website if you feel it's necessary or whatever, as opposed to not having anything and sort of it be a laissez-faire attitude, about what happens, I think you set a tone, that Suzanne says, if you're wearing masks and doing that, I think you really fortify your ability to take that 10,000 foot view.
All right, so here, and I think that's helpful, because I know that is, I think that's sort of underlying in so many things we were doing when we first look at somebody. Well, so yes, definitely, I love that less is more. We have our policies, as an organization. And this one you definitely touched on, and it's definitely the one that's on a lot of people's minds. We see it certainly on the news all the time, around with the variants and mutations. Are we going to see do you think we're going to see a mask mandate for schools in Ohio, say at the state level?
I don't believe we will, because there already have been bills that have passed through the state legislature which prohibit those. So at this point, the political majority has sort of overridden public health. If you do a Google search for Senate Bill 22, you'll get a much clearer picture of that. And I don't really want to delve into the politics of it, because we all have our own feelings on how that goes. But basically, the state legislature has limited our ability to mandate masks. Because I'll tell you what, from a public health perspective, if we could have every kid in every K-12 school would be wearing a mask, just because we know that that's the right thing to do from a clinical standpoint, from a public health standpoint. But there are a lot of other things that can color those decisions, certainly. But I would say in Ohio, I don't believe that to be true. I mean, meaning that I don't think that's on the horizon. And I also think, unfortunately, and I think I can say this freely, is with our governor running for reelection, I don't feel that he's going to make that one of the hills he wants to die on here. So I think we have what we have, and we're going to ride it out unless we take a horrible turn some other way. But I think, if you ask Dr. Vanderhoff, who is sort of the new Dr. Acton in terms of the ODH go-to for medical advice, he would certainly say apolitically, right? Regardless of who he works for, where he's at as a physician, he would recommend that people mask, and he would love to see everybody mask as we would. But I don't think I don't think a mandate is on the horizon.
Yeah, and I figured that was the answer. We were on a program last week with the U.S. Chamber, and actually the governor of Arkansas was on, talking about, he may have to bring the legislature back to lift that part of their state law, because they're seeing the, devastating effects of low vaccination rates and the ability to not, I think what he called it, the anti-mandate mandate.
Yes, right. Right.
Um,
And I think, Tom, what happens in schools will go a long way to be an indicator of where we go in terms of mandates. If we see hordes of children becoming ill, we see our pediatric units becoming filled with kids who have COVID, that certainly could change the landscape.
Right. So, yeah, I think it's a situation. If I was a school district, I don't want to be first and I don't want to be last in sending my kids back to school / whatever, recommendations happen. I don't see any more questions, and we certainly want to get people, out of here with a few minutes before their next 1 o'clock meeting, in person or Zoom, Microsoft Teams, WebEx, or, actually having coffee face to face with somebody. So I want to thank you guys again. This is, it's been incredibly helpful, from my perspective, and from the chamber's perspective, and being able to capture this information, and you guys taking this time, in the craziness of COVID and what we learn and where we go. And then lastly, to the participants on the call, we're going to have part 2 of this in September, and it's going to be focused on what specific businesses are doing. So we'll have a panel discussion with many of these same questions with a different lens on it, on how are they returning to work, how are they doing that. And we find it really interesting. As we were planning fiscal year 22, we did a poll of what do we want to hear more of and what do we want to hear less of, and the less of was certainly around COVID, but yet here we are discussing it because it is ever changing. But we definitely want to have the lens on what have we learned from a safety perspective, and how does that carry forward as we, go on this journey together. So thank you again, Kevin and Suzanne. And thanks for all the participants. Good to see you, Karen, from the Aurora Chamber. Mayor Kraus for hopping on the program today, and have a great week, everybody. And we will talk soon. Thanks.
Thank you.
Thank you.